All right. Okay. Recording started, everyone. Hello. Welcome to our. Okay. I hope the the screen is showing right. Yeah. Welcome to our AI's fun session, which we do host every 2 weeks, where we talked about the latest and the greatest in the realm of AI technology, whether it's the simplest things like maybe as you are all familiar with ChatGPT, Copilot, and to the much more industry specific stuff, as we'll be talking about today, because for this session's theme, we are talking about a little bit in medicine, in medical practice. So, what are some use cases that we can do as non-experts ourselves? I am bringing in one of the experts today, which I will be introducing in a little bit. But we'll be having a little bit of a demo on the reliability of using these chat-based AI tools for common diagnosis, and how are they using AI in general within the industry itself. So can open up your minds a little bit to it. And okay, and just a little bit of a recap on our last session, which was last month. We didn't have a session 2 weeks ago. I was a little bit busy, but yeah, we talked about mm, we had Ian do a little bit of a demo about breaking safeguards in Copilot, because Copilot has these all safeguards where you don't want Copilot making you a bomb. You don't want Copilot teaching you how to make a scam, right? But there are ways to bypass it, and which is just a little bit of testament of how important it is to have like strong safeguards so people don't use these tools for crime, right? And of course, we continued on uh, about how students nowadays using AI for their homework and all that stuff, how they are combating it by using these anti-plagiarism tools, doubling as an AI detection tool, even, right? So when they are submitting their homework, they are able to, see if these contents are original, so to speak. And a little bit of a demo we did with a Kanmigo Lite, which was, if you are familiar with the Khan Academy, they developed this AI tool which serves as your personal tutor in conjunction with ChatGPT. So you're able to, use their tool. Kanmigo is actually a paid tool, but they have a light version integrated into ChatGPT. So, if your kids are having problem and you're not an expert in the topic itself, you can be using a Kanmigo Lite, right? And a little bit as a closer, we also talk a little bit on, that this argument, does it matter that ChatGPT wrote that paper? A little bit of argument on memorization and using critical thinking. What's important in the realm of today's education? So that's still an open topic, open for argument. But for today's session, I'm bringing a little bit of a guest speaker, my buddy Forrest. Forrest, you want to unmute yourself and do a little bit of introduction?
Good afternoon. My name is Forrest, and I'm a final year medical student. And I just had a conference. I just participated in a conference. They're talking about AI in radiology. So Greg invited me and have a chat about it.
Yeah, yeah, I'm happy to have you around. We don't usually get much guests around here, but yeah, Forrest is finishing up on his MBBS very, very soon. Soon to be a doctor, that is. But yeah, thank you for coming, Forrest, and thank you for joining us today. Which in
No
today's
problem.
session, yeah, 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 always happy. And yeah, today's session we are gonna be talking about this thing called starting off with this thing called bakery scan. So it's actually a very widely used industry tool, but not in the way you think. Which, as you see, the name bakery scan is used for pastry. It's not for medicine. But we'll see how they actually transition this technology and using it for medicine, which is a very surprising success story. And this happened like I think more than 15 years ago, and we'll be transitioning this into having Forrest talk a little bit more about AI and radiology, which is his realm of specialty. And with this, there is an integrated tool that is very widely used called Analyze AI. I'm not sure if any of you are familiar with this tool, but it is actually also very commonly used in Malaysian medical space, which later on we will be sharing a little bit. It does touch on medical imaging, so and as a closer, later on, we'll be having a little bit of a demo on, doing common diagnosis with ChatGPT as a non-expert, as I touched on earlier. So, what's the pros, what's the pros, what's the cons, the good, the bad, and the ugly. We'll be touching on that very, very soon. But just to start off, there's this news on this technology called bakery scan and another one called Cyto AI scan. Right. Anybody here heard of this? Yeah, it looks like it's quite of a foreign topic, right? But this is actually something that popped up, I think back in 2013. So let me show you the gist of the article. So back in 2007, so this is a Japanese company, right? This is before the financial crisis. They're a software company. They got a request to be making, this sort of software so they can detect the sort of pastries that come out of the factories, come out of the cashiers, and it'll automatically detect it based on shape and, assign a price to it, assign a price tag to it. So, it makes the overall logistics much more streamlined, right? And from 2007 all the way to 2013, which is a very long time ago, right? You don't expect AI technology to be predating such a history even. And so after a 5 year long of this development cycle, they were able to make this this software that was able to identify over 50 kinds of pastries with incredible accuracy, right? So this is, one of the predecessors, I suppose, to AI, because when you're thinking of AI today, we are thinking about generative AI, right? Think about, ChatGPT, Copilot. So when you prompt something, they put out something based on all this data, all this big LLM data that they've collected, trained upon. But this one in particular with bakery scan, it was only limited to pastry, right? 50 kinds of pastries even. And so the interesting thing is that yeah, so a doctor back in 2017, so good 4 years after this was rolled out into the market, he saw this tool, bakery scan, and they thought of what if we can use this in medical imaging, right? And because he thought that these bakery items, the shapes even, right, how the techniques that it's being used to identify the characteristics for these pastries has as they say, a remarkable similarity to cancer cells that he has been studying, right? So he wants to see if this sort of medical, not medical, just imagery using this AI tool is able to be used to detect cancer cells that is like scanned under a microscope, right? So after they rolled out this tool, it was able to identify cancer cells under microscope with 98% accuracy, which is wow, that's quite a big deal, isn't it? Right? But of course, it was still limited in its usage when it first came out. I'm not sure if this is also a predecessor to analyze AI, which we will be covering about in a bit. Forrest, you got any idea about this?
I don't think so. Yeah.
Because yeah, this one, of course, it's just based on imagery, right? It doesn't have any sort of input other than the images that's being fed into the videos. Not very
Yeah.
sure how. Yeah.
So analyst AI, it's actually, I think it's quite similar to this in the sense that, well, they just train the AI with I forgot how many millions of radiological images. But in analyst AI, if I'm not mistaken, it's trained, with real images, real doctors.
Hmm.
Because I know there are different types of ways to train an AI. But from
Right.
what I've heard, they have the one of the largest sample size in terms of the images used to train analyst AI.
Okay. So it's kind of like ChatGPT. ChatGPT trains itself based on
Yeah,
information of the internet, right? But this is just a sample size of all the medical data that they have. Is it?
yep, yep, yep.
Yeah. Okay. Okay. That's very cool. We'll be diving then into a little bit further, but just a little bit of a look around on how the tool actually works. I got this off the YouTube channel of the company itself. So don't worry about the audio. There's not much to be listening to. Okay, yeah, so you put it onto the tray, and it was able to you click on this photo button, and it's able to accurately based on the shape, based on the characteristics on the pastries, it was able to what sort of bread this is, what sort of price does it tie into. So it's actually pretty simple, right? For a predecessor to generative AI made in back in 2013, even more than 10 years ago. So something like this already existed, and over that 10 years, it evolved to what we've seen today. Very, very interesting. Okay. Oh, let me stop that real quick. Uh, how do I do? Okay, yeah, yeah, yeah. So, I'm gonna pass it a little bit to Forrest, which he'll be talking a bit of, how AI is used in radiology, and I'll be chipping in a little bit as we see fit. Forrest, you're on.
Yeah. So yeah, well, I can't say I'm an expert in this field because I'm just starting to learn about this.
Okay.
However, essentially, the endless AI it's being utilized in approximately about 40 NHS trusts um, in the UK, and they just started to implement its AI technology in Sunway as well, which we will have um, a snippet of it later on.
Mm-hmm.
So essentially, the role of this AI is to help um, detect actually anything in the chest X-ray. So with Analyst AI, they have about 100-ish clinical findings that it has learned. So it's not designed to replace a radiologist because it does have their own weaknesses, which needs the help of a human to rectify it. And the primary applications for this AI, so which is Analyst AI, is chest X-rays and brain CT scans. And I think there are also other AIs to help out with other radiological findings. So in the conference that I was in, which was about 2 months ago, one of the doctors there, they were looking at breast mammograms, which is essentially an X-ray of the breast. So particularly for mammograms, apparently they need two uh, two consultants to interpret the mammogram. So essentially, there are different grades of doctors. So you have the consultants, which basically are doctors who have completed their training. So if you include med school for a radiologist to obtain a certificate of completion of training, it takes about 12 years to
Yes.
get that certificate. Yeah. So, and there's not a lot of radiologists here in the UK. You
Yeah, I
go to
think
the next
yeah,
slide.
give me a second. I think it's in our next slides, is it?
Yeah.
Yeah. Before we go ahead, I noticed that it says that, of course, it requires human oversight for final interpretation, which means that does this tool still produce like things like false positives, false negatives, and it's not perfect yet, is it?
Yeah, so it's from what I heard, it's not perfect yet. That's a lot of false positive. However, it appears to be more accurate at picking up stuff compared to a human, but then
Oh,
also false positive as well.
okay, okay. Yeah, yeah, yeah. Here, let me move on to the next slide. Okay, here you go. This is what you're trying to talk about, right?
Yeah,
Yeah.
so essentially, there's about 9.9 radiologists per 100,000 people in the UK. And this 9.9 includes all grades. If I'm not mistaken, it includes all grades of radiologists, which includes trainees as well. So, and if, well, you're a really junior trainee, you still need the your consultants or supervisors stamp of approval before you can make your document official. So 9.9 is a bit an overestimate in that sense. Um, yeah, and the average in Europe is about 12.8 per 100,000. So you put things in perspective. And then there's a lot of imaging techniques used across medicine. So common ones would be chest X-ray, not just your typical X-ray. So chest X-ray takes about 8.1 million annually because it's very, very important um, modality of imaging because
Hmm.
it is quite simple as well. So it's used widely. As for CT scans, I can't really find specific number for a specific type of CTs. Um, but the CTs we're talking about are essentially non-contrast brain CTs. So that's essentially contrast and non-contrast.
Hmm.
Um, Non-contrast, it's a more simple compared to contrast and
Is the
more
thing with
quick.
contrast the thing where you inject it with the contrast fluid, if I'm correct?
Yeah,
Yeah.
essentially it's a dye.
Okay.
Yeah, yeah.
Okay.
So it's more expensive and takes more time to get that. So yeah.
And so
Um,
with Analyze AI, they're able to do just more than X-rays, right? They're able to do CT scans. Is there anything else?
um, I think at least commercially available stuff, it's just chest X-ray and very specifically non-contrast brain CT. Yeah.
Okay. But the gist of the technology is that they're still looking at just these images, right? I think.
Yes, yes,
Okay, okay.
yes.
Let me move on to the next slide for you. Uh, okay, here we go. Yeah.
Right. So I've previously touched upon the types of radiological findings that this analyst AI can find. So essentially, there's about 124 radiological findings in chest X-ray and about 130 in our non-contrast CT brain. So, for example, in the chest X-ray, um, so before a radiologist can properly look at the chest X-ray, they need to assess its quality. So the analyst AI can also do that. For
Hmm.
example, if the patient is slightly rotated, they'll let you know, okay, the patient is slightly rotated, so you need to take account into this when looking at the
Mm,
images because um, if the patient is slightly rotated and you don't know that it is slightly rotated, you can see a lot of weird things like potentially bone problems because it is quite difficult to read um,
right, right.
a 2D image because essentially you're human, you're 3D, and
Yeah.
having these little scuffs in your image can make things really, really hard to um, see essentially.
So are like
Yeah.
most of the imagery done for Analyze AI just 2D images? Is there any like 3D counterpart? I'm not very familiar with it, but
Yeah, well, I mean, essentially, I think all images are 2D,
I guess so.
but yeah, but I guess you can think of CTs as 3Ds, um, as they're trying to be 3D in that sense because, um, let's see,
Yeah, I'm
a
trying to
CT,
remember, yeah, from my A levels at least,
yeah,
that that there's like maybe it was an ultrasound. I don't know what it was, but because you scan the thing with the I don't even know what it's called, and it produces some sort of like a 3D like a modeling thing, you know?
yeah. So that's CT. It makes,
Okay,
a few thousand slice. It takes a few thousand slices of X-ray images and basically paste it into one. So you can scroll through the images like you're looking at a 3D object, kind of. Yeah.
okay, okay, okay.
And and I guess well, this is not AI, but you can look at it with VR, and then it
Mm.
kind of looks like a hologram-ish thing. So that's quite unique.
Do you
But
know if yeah if Analyze AI takes just usually just a singular slice, or they just upload the whole thing in?
usually it's the whole thing. Um, because CT you would rarely see a single slice of CT. Usually it's whole chunk. Yeah.
Okay, okay, that's interesting. Okay. Yeah, let me move to the next slide in that case, which is yeah, pros and cons. Go ahead first.
Yeah. So the good thing about having AI helping you is that it saves a lot of time because it's quite um, difficult to have multiple radiologists to look at the same image. So because the AI is better at picking up stuff, it can, I don't want to say replace, but
Mm-hmm.
going back to the uh, breast mammogram scenario, um, so you need two consultants to look at one picture, and it takes a lot of human resources just to train one consultant, and their time is quite limited. So because that the AI is very good at picking up things, the AI can look through the images after or before the consultant looks at it. So, what I'm trying to say is that um, once the AI have looked through it, the consultant can check whether they are false positives or false negatives. Um, because in terms of the ability to pick up stuff, AI is better. But like we have said, it also picks up a lot of false positive, which is one of the cons. But I guess if you look at another way, it's also a pro. That means radiologists can still find work.
Yeah,
Yeah,
I mean,
and
especially as you said, there's still a shortage, right? So
yes, yes,
yeah.
yeah, because I guess not a lot of people like radiology, and there's not a lot of spaces to train for radiology. You know, what I mean by liking radiology is that the typical view of a radiologist is that you sit in a dark room, you don't see patients, patients don't see you. You're just alone there. Well, not alone, but just every day in a dark room. That's the I guess meme of it. Um,
It's like a depressing job.
yeah, yeah, yeah. That's how some people see it.
Okay.
Yeah. But one important thing that the AI can't do is to integrate the imaging results with the patient's clinical history. Because
Hmm.
as you know, well, every human is different from each other, and sometimes they might look like they're having something abnormal, but sometimes it's just it could be normal for them. Um, so knowing their history is very important. So history includes, why they are here for the chest X-ray, what are the medical conditions that they have, any particular lifestyle that they have, um,
So what you're trying to
family
say
history.
is that analyze AI just treats it, it's like a bubble, right? So it's just whatever's in there, it doesn't take into account anything else.
Yes, yes, exactly.
Okay.
And another very important thing about looking at images is that you want to compare images, the current images and the previous one. I
Mm.
don't think they can do that, but I'm pretty sure eventually they might be able to do that. But yeah, so you can see how things progressed or how things, didn't progress. Like if this lump is in the patient for, since 20 years ago, is it important to flag it up? Because it it might not be an issue.
Mm-hmm.
So there's a lot
Yeah.
of nuances, yeah,
Mhm.
that's hard to convey.
Yeah, I would believe that this is something that they can do, right? Just because it's historical data, you can just use the old data, train it into the model again, and then they can compare the differences even, right? I feel like that's something they can do, but of course, I'm not one of the developers. I can't say much about it.
Yeah. I think they're still training it in a sense. I think in the hospital when they use analyst AI. Sometimes the doctors can give feedback immediately after they've taken a look at the images. So, for example, if Analyst AI flags up this chest X-ray as potentially cancerous, and then the doctors looks at it and says, no, it's not cancerous, then it can
Mhm.
immediately give feedback to the AI.
Okay, so like yeah, it's like using the doctor's like feedback to train it even, right?
Yeah, but
Yeah.
something like a capture,
Okay.
basically.
Okay. Okay. Here, let me. Ah, there you go.
Yeah. So essentially, I guess from a patient's perspective, do you really care if there's an AI looking at your images, or do you care if it's a doctor? You just want, the correct diagnosis and get treated. That's it, right? Um, I guess the current issue is that, like we have said, there's a shortage of radiologists, and AI is very helpful because, well, it reduces workload, and because it reduces workload, um, they can get through your diagnosis faster. And yeah, I guess it's common sense, when you say, okay, um, of course, if you get the diagnosis faster, you get the treatment faster. Well, I think that that's a bit hard to say without, actual studies, because there's a lot of things that's going in the background. So sometimes it could be weird things that even though you get your diagnosis early, you won't have a faster treatment because there's a lot of teams involved. So radiologists would look at the images and says, okay, if there's a potential cancer or not. But then the oncologist, which are the cancer doctors, would give their input. So it's something that needs to be studied. And as you can see, the news says it does help uh, patients with lung cancers.
Yeah, I think also one of the biggest things is that sometimes patients, of course, are irrational, right? It's like even if your doctor is a certain, let's say a certain ethnicity, a certain culture, even they don't want to, I don't know if you've like experienced that yourself in your field, Forest, but maybe it can extend to even like, I don't want machines to be working with me. I don't want to, see AI working with my medical data even, right?
Yeah, yeah. So I think the interesting thing is that from the conference, I think most people, at least here in Scotland, they are happy with AI. And however, some of them are concerned that AI might take over their doctor's job, so that's why they don't want AI. And these are all from patients. So yeah.
Oh, that's interesting that the patients are the
Mhm.
one advocating to not, have their doctors lose their jobs.
Yeah, yeah, yeah.
Okay. Yeah, well, as you said, it's probably not gonna happen because there is a shortage, and the thing with analyze AI is that it still requires like human input to, interpret the results, right?
Yeah. Um, and that's one of the topics in the conference, because a lot of trainees were quite worried about that. I guess there's a potential of, I guess, simpler X-rays being taken over. Um, However, because you need images to train these AI. However, in the case of rare diseases, well, it's going to be hard to train the AI if there's very little
Hmm.
imaging there. Yeah.
Yeah, so
So
so yeah.
yeah, so I think it will be taken over anytime soon. But you never know with technology progresses so fast.
Yeah, I think in the short term, they definitely still need, extra data to be, training this AI tool to be better because as you said, it's not perfect then, right?
Yeah.
Yeah, okay. Here, here you go.
Yeah, and this is just one of the articles that I've seen, about radiologists being burnt out, and as a consequence of being burnt out, inevitably your the quality of work will also drop. And that's essentially what's going on in this article.
Okay. Yeah, yeah. I mean, I've seen this also happen in many other industries, right? Especially creative industries too. It's like artists burning out, like sure. But of course, the counter argument to that is, there's a balance between your burning out and over relying on these like AI tools, which of course I don't think it applies too much on a field like medicine because, it's mostly done for good, right? People don't really think about these if you're like, for example, an artist, you don't think about copyright, you don't think about, stealing intellectual property. This is not a thing in medicine, right?
Actually, well, I mean, yeah, not about stealing intellectual property and stuff like that. There was one of the doctors brought up that right, maybe trainees shouldn't use this because
Mm.
it's an easy way out.
Yeah,
So th that talks about maybe after you have completed your training, then you can use it. However, there are also people who says like, you probably know your own limits, um, and you should know that, you shouldn't rely too much on it, but it's good to use it. So it's kind of like a balance, you know.
yeah. I mean, yeah,
Because
yeah,
yeah, because everyone's an adult, they know about this, or well, at least, and these kind of things should be mentioned in their training
right.
and hopefully they won't rely too much on it.
Yeah, I mean, it's similar to university now, right? Professors definitely do not just want students copy and pasting their question or prompt into ChatGPT and popping out an essay because what's the
Yeah,
point in that,
exactly.
right? Yeah, which
Hmm.
is the main thing about education, which covered in the last session, is that the importance of critical thinking, even, right? Oh, I think somebody's joining. Give me a sec. I gotta put them in. Oh, okay. Did somebody? Okay, here we go. A second. Okay. Yeah. 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 In the last session, we talked about critical thinking, and of course, I think it's fine if you have already, developed this method of thinking and knowing how to solve these problems, how to approach it in the future when you're already in the peak of your career, using these tools. Of course, it would be much more of a help as compared to, a hindrance, as you said, Forrest. Yeah, when when trainees are still, in the process of understanding how these all work, if they're just putting it into these AI tools, then what's the point? I could be an expert, right? If you're putting me and just making me use all these tools, yeah, sure, I know how to use these tools, but I don't know how to interpret it even, right?
Yeah, yeah, exactly.
Yeah. Okay. Very. Yeah. Wow. And so yeah. So the thing we mentioned earlier was that analyze AI wasn't isn't just like a first world country, very premium, top of the line AI tech. It's actually very commonly used, as you see here, locally in Sunway Medical Center, even, right? Of course, maybe most of you will be familiar with Sunway Medical Center, but they have partnered with Analyze AI using their top of the line technology, using it in radiology, and I don't know if they. Okay, yeah, yeah, this is this year. So, the May of this year. Forrest, do you know when was Analyze AI like developed?
I think it was about 4 years ago, 4 or 5 years ago.
Okay,
Yeah,
wow.
it's
Yeah, so
developed in Australia.
okay, it's an Australian tool. Yeah. So 4 years ago would be, before tools like ChatGPT popped off, right? So this was, I think, ahead of its curve even, right? Yeah.
Yeah, but I'm not sure if it's, being used in medical field 4 years ago, but I think it started about 4 or 5 years ago, if I
Okay.
recall correctly.
Yeah.
Yeah.
Do you know if this is like an actual widespread use of this tool or if it's just like a niche that only some like hospitals have?
Well, currently I think it's quite widespread. I think like Hong Kong also uses it. well, UK, US, then now Malaysia. But yeah, I think it's not a very niche thing. It's getting more and more popular.
Yeah, okay. Yeah, I was actually trying to look for some demos for this, but there's nothing on YouTube. I don't know if you've got anything for us, but it doesn't look like because I assume this is like an industry like you got to pay for this tool, right?
Well, I guess they have demo by demo, it's more like examples. So essentially, it'll show you a let's say chest X-ray, and then you get the abnormalities highlighted. So for example, okay, there's a fracture in this chest X-ray. The chest X-ray is a bit rotated, things like that.
Okay. So
But
so
I don't
yeah.
think it's that useful in this presentation, I
Okay.
think, because yeah, you need to know a bit about me medicine or radiology. Yeah.
Okay, yeah. But the gist of it is just that you usually just upload this, a set of images and it'll just give you an analysis, is it?
Yeah, so it's integrated into the hospital system, if I believe so. So
Okay.
whenever someone takes a chest X-ray, it gets uploaded to the hospital's database, and then doctors just go online and grab it,
Mm.
and with the AI, before they grab it, they already have a uh, been analyzed by the AI itself. So I think you can just toggle it on, then you can see the interpretations by the AI. Yeah.
Okay, okay. Yeah. So I suppose it would be quite similar to, the example I showed earlier in the video of bakery scan, you have these you put it on top of the tray and then there's this part, this part, this part, and it'll even put like a highlight or bounding box, or this is happening over there, that is happening over there. Would that be similar?
Yeah, yeah, it'll highlight the abnormalities. Well, any abnormalities that can be highlighted, it'll highlight, I think.
Okay.
Because you can't highlight that, oh, this chest X-ray is slightly slanted, but you can
Yeah.
highlight a fracture, you can highlight a suspicious tumor, yeah, things like that.
Okay. Wow. Yeah. Wow. It came like really far. And 4 years ago, ahead of its curve even. That I'd like to transition to, our next segment. I'm going to be doing a little bit of a live demo because I'm sure a lot of you, maybe you've had this experience before. You've got like these sort of symptoms, but you're not very sure if you're going to check it out at a doctor because it costs money, right? But, maybe Forrest would be able to, chip in on how reliable is it using these chat-based AI tools for your own personal diagnosis. Of course, nothing too severe, so to speak. And what to look out for, what is to, when you're in a prompt, these, for example, ChatGPT, what you should be asking, what sort of details you should be, including. So let me switch on my screen real quick. Moment. Okay, here we go. And over here, and uh, okay, I think it's over here. Is my screen showing up?
Yes.
Okay, here, let me start a new chat. I'm testing it a little bit. So, for example, right, I think for a good like baseline, it's like let's say a patient comes into your room. Do you do like diagnosis usually for us?
No. So, diagnosis, it's a tricky thing. So I think in the hospital, usually only the consultant can diagnose someone with a disease. So, let's say if it's surgical related consultant, then you might need to wait some time for the diagnosis. However, there's like a few types of diagnosis. You got your differential diagnosis, which is basically my impression. So everyone can have a differential diagnosis, which is
So it's like more
well,
like opinion based, you think?
it, um, I guess you can say put it as opinion, but it's more like it's based it's still based on the patient's presentation, the patient's history and everything like that, because the consultant has much more knowledge. So you can tell the consultant like, I think this guy has an heart attack, but the final stamp would be by the consultant because he's well
Mm,
much more knowledgeable. He has completed his training, but you haven't,
okay.
so you can't give a diagnosis. But you can tell them your impression, your potential diagnosis. But
Okay.
yeah.
So, if like let's say a patient walk into your, your room, they book an appointment and all that. What sort of things do you think they'll ask for it? Because I know usually, you got to put in like the doctor's got to reach for the stethoscope, maybe an X-ray, et cetera, et cetera. But from words, maybe what sort of things do you think they can, convey even before visiting the doctors?
You mean for a patient?
Yeah, yeah, for a patient, right?
Yeah. So the most important thing would be what made you come to the hospital? So basically your main complaint. So when we talk to patients, as a doctor, we want to know what's the thing that's bothering you the most,
Right.
and then we start to get details of that thing. So for example, you come to see me and your first thing is pain, right?
Sure.
So first thing we want to know, where
Yeah,
is the
let me
pain?
yeah, let me integrate that to one of our prompts. Okay, so let's say for example, it's like experiencing pain in somewhere. Give me a spot first.
I guess chest pain. Yeah.
The chest. Okay. Usually, is there like any supporting thing that goes on with just pain in the chest? Do you usually gotta go like more specific?
Yeah, so for us it would be okay. So is exactly where is it? Is it like centrally in the chest, or is it maybe on more towards the right, more towards the left? Is it a, stabbing pain? Is it a crushing pain? And how did the pain progress? Is it getting worse, getting better? Uh, like any particular movement that makes it worse? Like certain pain gets worse if you take a deep breath in. Certain pain gets worse when you lean forward or backwards,
Okay.
and that's a lot. Yeah.
Okay. Let me admit somebody in. Okay. So this is what I got right now. For example, a patient or maybe me, I'm thinking about, oh, I'm having experiencing
Yeah.
this sort of pain in the chest, closer to the shoulder. It feels like a stabbing pain and it worsens if I take a deep breath, right? So if I do
Hmm.
ask ChatGPT, it's like, what is your diagnosis on this? Of course, it's not, ChatGPT is not a medical expert. It's taking off of publicly available data, right? So let's see. Of course, it has to do this thing with the safeguards. I'm not a doctor, of course, right? So it suggests that this could be something with a pleuritic chest pain.
Yeah. So essentially, pleuritic chest pain is a sharp pain in the chest that gets worse when you take a deep breath in.
Okay. So it's literally specific to that. Okay.
Yeah.
And it pulls out some of these possible causes. Of course, collapsed lung, blood clot, okay, which is, a bunch of things,
Hmm.
which I don't know if usually if making it more specific helps with the diagnostic or, you know,
Yeah, it does help. But what I can say is that these are the basically the things that kind of pops into my head when you
okay.
say that. So yeah.
Yeah. So it
Um
is like what ChatGPT is saying is in tandem of, what do you would think as a medical, like somebody who's been training in medicine, right?
yes, yes.
Okay.
Be- because you need to rule out the worst things. So like they say, the blood clots, it's quite bad, and then collapsed lung is also quite bad. Depends, there are a few types, and then pericarditis. I think it's usually not that bad, although it sounds terrifying that there's inflammation of the heart. Yeah.
So, is there like any, because I know you've done a bit of research, right? And like writing papers, and when you're like looking up this sort of like medically related data for your papers, is there like any sort of, sometimes where it misleads even
It, what do you mean by that? What is
because it's like
misleading?
let's say you're trying to like because I know this is like a very popular meme out there. It's like I'm like I'm searching up symptoms for a fever. I'm searching up symptoms for a flu, which I think I have, and it comes out like cancer. Does that like happen?
Well, I mean, but it's kind of true that you can have cancer because let's say
Okay.
if you have like leukemia, which basically drops your immune system to zero or near zero, and then you get a lot of flus or infections. So that's one of the signs of it. So I mean, it's technically correct, but how common is that? It's not very common.
Yeah, yeah. Maybe because I know they always it's called like WebMD or something. It's like you search it up on WebMD,
Oh
and then
yeah,
yeah, I guess they just pop up with the most extreme cases, which could be possible, but unlikely.
yeah,
Yeah.
essentially, yeah.
Okay. Yeah, yeah, yeah. Does that usually happen if you like search it up on ChatGPT instead? Well, I can do a search, I suppose.
No, I
Yeah.
don't think so.
It's like let me start this with a new chat so it doesn't. Yeah. Okay. So I'm experiencing heavy sneezing, shivers, and maybe like numbness and overall lack of energy. Okay. Any diagnosis? Something like that. So of course, just yeah, okay, common cold or flu, allergic reaction, that's sure. Or COVID, I suppose. Of course, yeah, yeah, yeah. Okay, neurological, which of course I guess it's not. Yeah, it doesn't pop off into the most extreme cases like WebMD, I suppose. But they do like mention it a little bit. It could be a thing, right?
Yeah, but I guess you might also be throwing it off because from my knowledge, I don't know a disease that combines, a flu with numbness as well,
Okay.
unless it's two different disease acting at the same time. Well, I mean, but it could be just my limited knowledge.
Yeah, yeah, because well, the thing with like patient like what a patient feels like it could be like over exaggerating things, right? They could be feeling things
Yeah,
that, it's not present. Is it
yeah.
like usually the case?
Um, mm, I don't think so. It's not usually the case. However, there are some terms that they use that might be a bit fake. For example, dizziness. Like my definition of dizziness might be different from your definition of dizziness because dizziness it's quite vague
Hmm.
and one thing that people like to call dizzy is vertigo. Basically, it's when the room starts spinning, or you just spin on your chair for like
Mm.
maybe a good 1 minute, and then you see
And
your room spin.
I guess that would
Yeah,
be different from like, let's say if you're having like a sharp headache, even, right? Maybe somebody would say like a headache is a dizziness, like a sharp pain, even.
yeah. Or
Yeah.
sometimes they call lightheadedness dizziness. Yeah.
Okay.
Um,
So
yeah.
yeah, I'm wondering if if ChatGPT can differentiate if I put in I'm experiencing dizziness. It's like what sort of thing will I think about? Oh, what is it? Experiencing dizziness. And what are like some common things that happen to dizziness for us?
I guess um experiencing dizziness randomly, maybe you try random.
Sure. Randomly, but this is like a very general thing, right? Let's say if we just don't put anything specific, we're not talking about the sharp pain, we're not talking about the our vision being blurred or something. Let's see what sort of diagnosis. Uh, what will ChatGPT come out with? Okay, as you say, vertigo. Yeah, hypertension, blood pressure, blood sugar. Okay. But it does seem like because my prompt doesn't really go into the specifics of it, it gives you a much more wider range of causes.
Yeah, yeah. So. like for me, I think it's good in a sense that they'll specify its vertical. Is that? Yeah,
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 this one.
okay.
Yeah.
Yeah.
Oh, crap.
So it's
Okay, there we go.
yeah. Vertical is one of the things that popped up and which like to my knowledge, that is, a different definition of dizziness. But it's good that you picked it up because
Hmm.
that is the thing that goes through my head when a patient says, "Ooh, I'm feeling dizzy randomly." Um, and then obviously the thing that I need to do is to ask and clarify what do they mean by dizziness? Is the
Yeah,
room spinning? That will probably be one of my first few questions. Yeah.
right. So I suppose that ChatGPT, like as like an example, would be, I guess, a good way if somebody who's experiencing these problems, maybe nothing too severe, to just put in a diagnosis of your own before going to the doctors. Do you think that's a more responsible thing to do, or should you just go to the
That
doctors?
I think it might be better to just go to the doctor because I feel like there's a lot of nuances because you need to know how to ask the questions
Mm,
and things like that. Because a specific way of asking the question might give you a specific diagnosis.
right.
So, for example, I think if you tell ChatGPT, I'm feeling a centrally crushing chest pain that radiates towards my left arm and left side of my neck and jaw. I think I'll know what the diagnosis is.
Oh, wait. Can you
Yeah,
repeat that?
yeah. So a centrally crushing chest pain
Okay.
that
Yes.
radiates to the left arm
Left arm
and
and
left neck and lower jaw.
lower jaw. Okay. This was it, right?
Yeah.
Okay. And yeah, let me try to ask it. It's a simple one. A heart attack. Do you think that's
Yeah.
a possible thing?
Well, I mean, that's your classical appearance of a heart attack.
Okay.
Um, so I think the thing is, if you tell this to any doctor, I think the first thing that pops up is, oh my God, is this guy having a heart attack? Um, and then you'll probably try and treat it as a heart attack first. So yeah.
Okay.
However, like they say, there are some aortic dissection is also a very important differential, but that it does not classically appear like that. Yeah.
Okay.
Um. Yeah.
Yeah.
So.
Well, you did like recommend you should just go to the doctors, right? But this is like in a place where the doctors is it's free over there, right?
Yeah. Yeah. Yeah.
Okay. Yeah. So advice applies if your doctor is free. If your doctor is not free, well, I don't know. Your mileage may vary. But
Yeah.
yeah, okay. I think we can end it right here with the demos. If anybody has any questions, I'll open it up for a minute. Anybody got anything? Stop sharing. See if anything's in the chat. Yeah, yeah. Thanks for sharing, Forrest. Wow. I'm very happy that
No
we finally
problem.
have a we finally have a guest.
Happy to share.
Yeah, yeah, yeah. And thank you everyone for joining. I don't think there's any questions. One more minute. Yeah, because somebody I know was having some sort of these sort of problems, and of course, we naturally in today's age, people go to AI and seek diagnosis first before pursuing any further action, and just wasn't sure if it was accurate in the first place.
Yeah. But the thing is, actually, it depends, on the patient themselves. Like if they, know a bit more about medicine and know what to ask. Sometimes their self-diagnosis is accurate, although not most of the times. Uh,
Mhm.
I mean, I'm not sure about that, but even some rare diseases they can diagnose themselves, to be honest. But I mean, they can, but doesn't mean that they should.
Right.
Uh, because, well, I mean, if you misdiagnose yourself, that's a huge problem.
Right.
And, it takes about 15 to 20 years of training to like diagnose, officially diagnose someone. So, just, Googling things probably isn't the best.
Right.
However, it's based on, I guess, your situation as well. Like if it's a cold, you know,
Yeah.
as a typical person, would you want to go to the doctor? And probably not unless it's quite
Right.
severe, right?
Right. Yeah. Yeah, I had a thought. What was it? It's like if you're, yeah, it does come down to, how well you're able to, diagnose yourself, which is also a thing with AI, right? It's like how well you're able to make the prompt be, right? How specific it is, if even the AI understands your question in the first place.
Yeah, yeah.
Yeah.
And I
And
guess
yeah.
maybe a potentially good thing is that maybe well, not a good thing, but if the AI could ask more questions, that might be
Mm,
good.
yeah, follow up, huh?
But I'm not sure. Yeah, yeah. Like
Yeah,
some people might say chest pain, and
right.
then maybe they could clarify, okay, where exactly and what type of pain it is,
Right. Yeah. One thing I'm not very content with the current like ChatGPT Copilot is that they don't really ask follow-up questions. I know like because last time I was talking about Kanmigo Lite, the thing of the personal tutor, right? And I think with a personal tutor with Kanmigo Lite, which is an AI tool, it's like every time you have a question, it pops out right here and it gives you like a follow-up. It's like, what should you look into? What sort of questions you should be thinking about? That sort of thing. I think that part is the important bits, even, right?
Oh, yeah, speaking about that, I mean, ChatGPT sometimes does give me follow-up questions when I'm looking up recipes. Yeah,
Oh,
they do.
yeah. Oh, okay.
Yeah.
I think yeah, it's on a case by case basis, I suppose. Then okay.
Mm-hmm.
Yeah. Okay. I think we're in the session here. Thank you, Forrest. Thank you again for
Yeah. Thank you for
tuning
inviting.
in. Yeah. Thank you, everyone. I think I'm gonna
Thank
end the
you.
recording here. Thank you, Ratnam. Thank you. Thank you, Noah.